Hi, everybody. Dr. K back with you for contact tracer training. This is Unit 3, Part 2, and we're going to talk about establishing rapport and some of the effective communication skills that will help you establish rapport. What is rapport, and why is it important to a contact tracer? Well, if you have rapport with the person you're talking to, there's a feeling of mutual understanding, perhaps establishing trust and agreeableness between people. You need to establish rapport in order to successfully contact trace. To be able to get information from people, take some communication skills. To be able to educate people about the coronavirus, about COVID-19, take some communication skills. And sometimes when we're not able to mandate quarantine, isolation, mask wearing, etc., it's our persuasive skills that get people to do things for the public good. So we want to be able to conduct effective calls with cases or contacts using good questioning skills, using active listening, and communicating effectively with, responding to people's observations, people's feelings, people's needs, and people's requests. So we need to really connect with people. This requires empathy. Empathy is being able to put yourself in that other person's place by voicing compassion, because the attitude that you display will really affect the quality of the call. We want to be assertive, of course, but we don't want to be aggressive, and we don't want to be passive either. Assertiveness implies that you have confidence in what you're doing as a contact tracer, that you speak to people honestly and directly, and yet have a reassuring tone to you. But we don't want to be passive, because if we get people responding either inappropriately or not communicating to us that they understand, we want to be able to question them. We want to be able to push back a little bit without being, again, aggressive. We don't need to be intense. We don't need to be harsh. And we're not looking for confrontation. What we're really looking to do is establish some mutual, rapport. For example, being assertive might be saying, you'd like to know why I'm asking you to stay at home. Well, by staying separated, you're helping your loved ones and the community stay safe. And by being passive, you might say, well, if you don't feel like doing it, if you don't want to, you don't need to. Well, we certainly don't want to be passive, or we don't want to be aggressive by saying something like, you have to stay home, and you should listen to what's good for you and your kids. So there's a difference between being assertive, being passive, and being aggressive. Nothing wrong with being assertive. And be careful now. We're not trying to impress people with our vocabulary. We want to avoid using technical words that we know from the field, like case, contact, infectiousness. Rather, we want to use simple words. Someone who is sick, someone who's been around a sick person. When can you spread this illness? In other words, we want to talk to people in a down-to-earth, simple manner. Not talk down to people, of course, And we don't want to just rapid fire questions at people. You know, too many questions at once confuses people. And then when you ask too many questions at once, you don't get clear answers. One question at a time. One message at a time. You want to get information processed by people. And people take time to process new information. First, you need to make sure that they understand. And so constantly asking them, are you with me? Do you understand what I'm saying? So we want to communicate one question at a time. We don't say, do you have a fever? Do you, shortness of breath or a cough? If they say yes, well, which is it? All three? No, we say, do you have a fever? Do you have shortness of breath? Do you have a cough? Or what symptoms have you had since you got sick on Monday? One question at a time. Avoiding the common mistakes like talking too slowly to people, talking too quickly to people, sounding unfriendly, sounding like you're annoyed as the contact tracer, or even bored by what they're saying. No. We need to practice empathy. We don't want to talk too loudly like we're yelling at people. Or even more annoying might be talking too softly, too passively. We don't want to interrupt them when they're talking unless they're going on and we need to move on to the next issue, but we need to do that gracefully. And we don't really want to offer our personal opinions. We want to provide facts. We have to be comfortable knowing that we don't know everything. And sometimes we need to refer the case to a supervisor or refer people to a healthcare worker for medical advice. And our ability to contact trace is really related to our ability to ask questions effectively. Because people respond to questions differently depending on how they're worded. So effective questioning can be very important to a contact tracer. So, for example, we can use different kinds of questions with the same contact or case. A closed question, an open question, a probing question, maybe just to confirm a checking question, or maybe we want to lead people into thinking about the best way that they should answer for their family if we can do that effectively. For example, a closed question might be, have you spent an extended amount of time with anyone without a mask in the past 3 days? They might recall a conversation they had in the doorway and both people not wearing a mask and being only a couple of feet apart. An open question could be used like, how have you been spending your time since you became sick? Or you might want to probe. So you went for a walk. Did you chat with anyone on the way? Or you might want to make sure you heard what they said. So you said you didn't live with anyone, is that correct? So you said you had no visitors, is that correct? And then you might want to lead by saying something like, so I could assume you didn't see anyone? And perhaps they might remember. And you can ask them to check their calendars, check their text messages, check their social media. That will help them remember what they did during that time. Because, life is busy and sometimes you don't even remember what you had for lunch yesterday. So it's very important not only that you ask questions effectively, but that you communicate to your people that you're listening to them. Active listening makes people realize, think that the person talking to them hears what they say. It creates more rapport between you and the person you're talking to. And it gives them a space to tell you more and perhaps even more important details. And so when you may have to check in with them again to see how they're doing, how the person they're living with is doing, you already have a bit of a relationship established. Listen for what they're saying. Listen for what they're feeling. And give them the space and the silence to give them the time to talk. So that you have a demonstration of empathetic listening. That you're listening without judgment. And you're noticing what is happening for them and for you in terms of how you're establishing rapport, and you're getting from them what emotions, what feelings they have, so that they have the space to be for honest expression. And these may seem like all common sense communication skills, but these are really the heart of the matter when it comes to your effectiveness in contact as a contact tracer and helping your community prevent community spread of this COVID-19. I'm Dr. K, and I will be back with you again for Unit 3, Part 3. Bye.